Thank you very much for your interest in our article, which appeared in the Journal of Neurosurgery Spine, looking at outcome differences between patients who underwent lumbar discectomy, minimally invasive versus open traditional approach. We've been doing minimally invasive surgery for about 15 years now, and time has come for us to try to understand truly the outcome of these patients when you compare them to those who have the open traditional lumbar surgery for discectomy. This was the reason behind why we did this study is for the public, for the referring physicians, for the treating physicians, and for the public in general, as I said, to understand the differences in outcome of these patients. If I have a disc herniation, am I better off having it done minimally invasive or open? I think now that data has been collected over the past 15 years from multiple centers, it's important to pull it together and see what the true outcome is. Is minimally invasive better? Is open discectomy better? And it's for this reason that we launched this study. We looked at about 837 patients who were followed for at least a year each. And over 6 separate studies, we pulled them together. And using various statistical methods, we're able to decipher some interesting conclusions from that. Well, what we found was quite interesting, actually. We found that indeed there's no difference in outcome between those who undergo surgery for lumbar disc, minimally invasive versus open. So this issue of minimally invasive kind of spares muscles and leads to faster recovery and a better outcome did not pan out when we looked at 837 patients who were followed in a randomized controlled fashion in a meta-analysis over multiple studies, but in a meta-analysis of those patients. So indeed, open is just as good as minimally invasive. We found something interesting, though, that the patients who underwent minimally invasive had higher intraoperative complications, meaning that, and that's probably due to poor visualization with the minimally invasive. You can't see as well as a surgeon, and there's a higher chance of injury to the dura. This did not lead to long-term consequences, and that's why the outcomes are the same. And the total complications, not just the intraoperative complications, but the total complications were exactly the same in these patients. So the answer is that we cannot say that one method is better than the other. They looked equivocal, the same. Whether you have an open discectomy or a minimally invasive discectomy, it's the same. The only caveat is that with minimally invasive discectomy, you have a little bit higher risk of intraoperative injury to the dura, which in a lot of times is inconsequential. Well, these conclusions are in sync with the conclusion that other studies have reached. Both procedures lead to good relief of leg pain, not just in the short term, but also in the long term, greater than 1 year. Patients do quite well with both procedures. However, as I said before, with the minimally invasive route, due to poor visualization, you have a higher rate of injury to the dura. What do I make of these conclusions? I think physicians, both treating and referring, as well as the public, needs to know that minimally invasive surgery for lumbar discectomy is not better than open surgery for lumbar discectomy. Thank you.